Very good morning, Highnesses, Excellencies, ladies and gentlemen. It's wonderful to be here. I know this morning has been a fantastic start to what I know is going to be a really insightful couple of days. Now, I hope we can help you all out by just sort of laying the table, as it were, about where we are today with the science of longevity and where very excitingly, we are headed. With me today is a disruptor. Peng Xiao is the global head of G42, which is the AI disruptor, as it were, the AI company here based in Abu Dhabi, working through a myriad of business and investment strategies across sectors, but for the purposes of today's discussion, very much imbued in what the healthcare sector looks like here today and what it will look like going forward. Before we start, I've got a little helping hand, an extra panelist with us today. But before we start, what does longevity mean to you?
Becky, good to be here again with you. We had multiple sessions previously at Davos talking about global affairs, but this is a subject, healthcare, close to both of our hearts. Your Highness and Your Excellencies, a pleasure to be here with you as well. For me, longevity is more than just living longer. It's about having an active body and maintaining a sharp mind. It's the fusion of mind and body coming together with holistic well-being. And I happen to believe, as you mentioned earlier, being a disruptor in the AI field, for the first time, we have this opportunity where biology and information science can converge towards what I call healthcare singularity. And if you allow me, I want to give you a little background of how Abu Dhabi started its program on population health and why a company like G42, which started as a big data company, got involved in healthcare business in the first place. Back in 2017, I had an interesting conversation with our national leadership. We discussed the fact that there is a reference genome program in many parts of the world, multiple in the US, multiple in China, but across the entire Arab world, there's not a single reference genome, genomics sequenced of our population here. So when our leadership asked me, well, how many samples you need to make it a meaningful reference genome for our population? I said, maybe 50,000. The question was asked back to me, well, would more be better? I said, well, sure, more be better, be more accurate, because everybody's genome is slightly different. That's when I was given a challenge. Well, go ahead, run a genome program for every single person in the country. Don't do a sample. Give every individual their own proper, accurate, factual reference genome. Becky, as you know, we discussed off stage. In your entire DNA sequence, there are 6 billion data points. It's like a giant book about who you are. It's your source code. So to understand, not just sequence it, but understand all this data, it is indeed a big data challenge. That's why our company got involved. And today the program is directly supervised by His Highness Sheikh Khaled. And we are taking this data set to help with drug discovery, preventive medicine, and everything else for the population.
We were hoping to be joined by Peter Attia today, one of the biggest names in longevity science. His pioneering work in preventative care and precision health presents a future where health span, not just lifespan, is the new metric of progress. He talks about medicine 3.0, which very much twins and mirrors Abu Dhabi's vision for healthy longevity going forward. And the work that you are doing very much plays into that vision for 2030. So before I get you to, go on, just explain how what you are doing with regard AI and genomics, for example, fits into that new vision for healthcare here and how it might provide a blueprint for healthcare around the world?
I think it's a great question, Becky. I do wish Peter was here with us right now. He's a dear friend and being a friend of our nation for many, many years now. In his book, Outlive, where he outlined this paradigm of medicine 3.0, one key thesis is that we have to respect the data. Not just how we feel, but what does the data tell us? It's data-led medicine, evidence-based medicine. I believe what we're doing today in Abu Dhabi and UAE, building a national initiative, can take what Peter's practicing to a rather small, some people say elitist, small group of clients, take it to the population level. Peter's doing amazing cutting-edge work. He's using the data, deep data set of certain very, very well-resourced clients, helping with their personal health. If we can work with Peter, take the model he's built for individuals, and take it from data-led medicine to become an AI-centric medicine approach, we can do so much more. I'll give you an analogy on this if you don't mind. We are all living right now in the age of a generative AI revolution. Large language models are everywhere around us. We are now all somewhat powered, some people more than others, with AI agent in our pocket. A teacher, a dietitian, a physician, it's in your pocket right now. But it's not quite there yet to solve the fundamental issue of biology. Biology is so much more complex than human language can actually describe. We've put all the known human language ever written, pretty much, inside these giant models which require the gigawatts of power and massive GPU cluster to train. And this model has been proven to be very effective. By just reading human language using the transformer model, we can produce generative intelligence, not just predictive, can create new ideas, new concepts, applying human logic to it. Now, Becky, imagine we go beyond the human language that today only, like right now, being used to express our thoughts. We actually can take a new language of biology, the genome data. Like I said, how many words can you speak a day when your DNA itself is 6 billion data points? All your biomarkers, all your medical images, every scan you've ever taken, all your EHR records. Do you wear a Whoop? I wear a Whoop every day to collect information about my lifestyle. All this data, it is the language of biology. Me and many of my colleagues, I'm sure Peter's excited about this as well, we want to build a new large model, but it's not a large language model, but large biology model, which for the first time, all this computational power can be applied, transfer model can be applied to understanding the mystery of human biology and unlock truly longevity.
This is fascinating. I mean, Peter will say, I know that you'll agree with this, that there's no magic pill, there's no silver bullet that solves all of our problems and prevents us from aging. What we're advocating here, as far as I understand it, is healthy aging. It is preventing that sort of decline, that unhealthy decline. Before we carry on, and I get you to do a sort of slightly deeper dive into where you think the future is heading, what you're most excited about. We've got an AI avatar with us tonight. Her name is Mariam. And I want Mariam just to provide some sort of global context for what we're doing to help frame this discussion. Mariam, what are some key data points that can help today's discussion on the future of global health, if you will?
Global health is a broad and complex topic, but there are a few powerful trends worth highlighting. Since 2000, global life expectancy has increased by more than 6 years. But that progress isn't equal. People in low-income countries still live, on average, nearly 20 years fewer than those in high-income countries.
Well, that is a big gap. So how do we close it? How do we live healthier lives?
Many of the biggest health issues are preventable. Up to 80% of heart disease, strokes, and type 2 diabetes cases could be avoided through healthier daily choices.
Well, that's encouraging, and I'm sure many in this audience are encouraged by that. Are we living well at this point? That is the point, correct?
You're right. It's not just about living longer, it's about quality of life. On average, people spend the last 12 years of life in poor health, often with preventable chronic conditions. Healthy years matter just as much as lifespan.
Thank you, Mariam, and I'll come back to you momentarily. Peng, the Healthy Longevity Vision 2030 in Abu Dhabi is not just a slogan, it is a strategic framework with concrete goals, with substantial investments, and a clear commitment here to transforming healthcare. What are you most excited about?
I think you got to marry and you don't really need me here anymore. She's much more articulate than I can be. This really shows you the power of AI, just processing language. Again, I want to say not if, but when AI can unlock the language of biology, we'll all truly understand the secret to healthy living. I think there are two things I'm most excited about, Becky, in this broader program of Abu Dhabi. Number one, I'm excited that we are building an AI-centric nation here in the UAE. Again, everything Peter is doing, everything Cleveland Clinic is doing, I see Tom is here, it's all based on getting accurate data to describe our human biology and interpret this data with science and give us answers we're looking for. So by building this massive AI platform right here in the UAE, we will have the physical infrastructure to understanding that science. That's number one. Number two, what I'm excited about is something I practice myself, which is, for me, the secret to healthy living is to stay active. Very simple. Like Peter said, don't wait for a pill. Don't just take the pill and say, I'll be fine. You have to keep your body active, and you have to keep your mind sharp. That's the only way to maintain a healthy life.
There are two questions that I get asked a lot when I talk to people about my interest in the science of longevity. And they're classic questions that I get asked a lot when we're talking about AI and advanced tech, and they are the following. There are pressing ethical considerations around longevity science. So the first question is, how should we address those? Coming from your perspective, perhaps rather than sort of philosophical perspective. And you brought up the word elitist and these sort of concerns about longevity medicine being elitist, inherently elitist. How do you respond to that? And what steps can be taken to ensure that advancements made here, as Abu Dhabi provides somewhat of a blueprint for global healthcare elsewhere, how do we make these advancements more accessible to everybody? I'm being quite serious about that.
I'll answer your second question first, if you don't mind, Becky. Maybe this is controversial, but I think there's nothing wrong starting something with what we call elitist approach. The cutting edge, by definition, is not for the masses. It's for a few. It's a grand experiment. It's those who have the resources and the desire to push the envelope. So what Peter's doing and what many other global longevity experts individually are doing, yes, they are serving a small client base today, but they are pushing the envelope. They are building new prototypes, new models. What we will do is that as soon as we understand a model actually works, our job is to scale it. Example I gave you at the beginning of this conversation was when we first started in 2017 to launch the population genome program of the UAE. the cost of doing a WGS, whole genome sequencing in the United States, was over $2,000 per person. But when we decided to do for 1 million people, we pushed the cost down to below $100 per person. The same thing will happen here. I think the longevity program Peter's practicing today, reserved for only a few, the elite. Once we know it works, we can once again scale this out to the population from maybe $500,000 a year program down to a $500 a year program for the population. I think with scale of the population participation, proper government policy, and the aid of AI, advanced generative technology, we can drive the cost down significantly. And to your first question, I'm no expert on policy issues. I think His Excellency Mansour Mansouri from DOH, they can better answer that. But I believe if the government provides proper oversight, like the case of our population genome program in the UAE, it's not managed by G42. We simply do the processing work. The oversight is with our national leadership and with our government. They ensure the proper privacy and proper usage of the data.
Last question, because we've run out of
Becky,
time.
we have a surprise guest for you.
Oh.
Peter is here.
I wonder why they were setting up here.
Is this a really Peter or this is Avatar? I need to be sure.
Was that the Avatar? Who was I was going to the Avatar for a question. Peter, it's fantastic to have you. Peng has been filling us in from the AI and advanced tech perspective on how the work that you have been doing as an expert, a global expert in longevity science, mirrors the work that is going on here through the work that Peng's team is doing to fit the healthy longevity vision that Abu Dhabi has. So it's great to have you here. Thank you. And can we just get from you a sort of lowdown as a disruptor? I mean, you're a contrarian. You're a physician first and foremost. You're an author. You're a podcaster. But you're ultimately a disruptor. Why is what you are doing in longevity science, why is it right and why does it make sense?
Well, first off, enormous apologies for being late with another meeting, but thank you for your patience and thank you for having me here. That's a hard question to answer because it suggests that my approach is the right approach, and I think one has to guard against too much arrogance. I can tell you why I think the way I think about this problem makes sense. And I suppose it's because it's approaching it maybe from multiple levels. Mm-hmm. I also think that the approach that I think about is treating lifespan and health span equally. And I think maybe in the zeitgeist, there's a bit too much emphasis on lifespan and immortality. When people hear longevity, they think about living forever. And I'm not convinced that's possible. And I think that might be a bit of a fool's errand. I think that just using what we know today technologically, I think there is ample opportunity to extend life by 1 to 2 decades. But more importantly, the ability to do that with complete preservation of health span and actually adding functional years to people is simply a matter of knowing what the right thing to do is and not necessarily even inventing something new.
Outlive, and we've been talking about the book here, Outlive is fantastic. The key takeaways that I got from it were health span, not just lifespan or health span rather than lifespan. Medicine 3.0, which we'll talk a little bit more about, and then the importance of emotional intelligence. Overlook that, you say, effectively at your peril. Can we just take each of those sort of 3 takeaways, if you will, in parts? You just talked about health span over lifespan. Can you just break down those sort of 3 key elements, if you will, and talk about in 2025, where you are at and how the model that you have can be adapted to global healthcare projects. When we've been talking about how some of what you do can be seen as somewhat elitist, how it can be made scalable and affordable.
Yeah, well, lots to unpack there. I'll try to get to it all in this answer, but if I forget, please remind me. I think I sort of talked about why I think health span is just as important as lifespan, but just to share anecdotally, you know, when I take care of patients, which still takes up about 40% of my time to this day and will continue probably indefinitely, in a way that's the lab, that's sort of how you're learning as you're taking care of patients. Without exception, when people come and see me, they are more interested in optimizing their health span than lifespan. They're not chasing immortality. They just want to know that when they're in their 80s and 90s, they're going to be able to play golf, play with their grandchildren, travel without pain and things of that nature. So I think we just know from that experience, people want health span. As far as Medicine 3.0, again, I think unlike the way Medicine 2.0 needed to displace Medicine 1.0 and completely put it to the wayside, the difference we're dealing with in this transition is that Medicine 3.0, which I assume has been defined already, needs to run alongside Medicine 2.0. All of the benefits of Medicine 2.0, the ability to treat infections, acute illnesses, and things of that nature, that shouldn't go anywhere. What we need is a system that runs in parallel that treats health span on equal footing with lifespan and takes a much more early and aggressive posture towards the prevention of chronic disease. I think the final point you made was around the elitist nature of longevity medicine, and I think you're absolutely correct, or at least the folks who render that criticism are absolutely correct. And the best example I have for it is sort of like, and this is a US-centric example, so I apologize, but look, when Tesla came out with their first vehicle, it was a Roadster, and I don't think anybody thought that that was the vehicle that was going to change electrification for vehicles, but it was the proof of principle. And as you worked your way down from a Roadster to a Model S to a Model X to a Model Y, it becomes more and more viable as time goes on. And we are exactly at that point right now in what we're doing. So it's true that my practice, it's clearly something that with the resources we put into it is only available to a select few. We are in the process of building something that obviously heavily leveraging AI and digital technologies, we think is going to be scalable, basically at the cost of a cup of coffee a day.
I know that you don't just preach longevity, you live longevity, and you live by the principles that you are, bringing to so many other people's health and welfare at this point. So a question from Miriam. I know you've got a question for Peter. Miriam, to that end, what is it?
Dr. Attia, what personal habit or intervention do you believe has the greatest untapped potential to improve population-level health span?
That's a great question. Probably exercise has the greatest impact at the population level, and by extension for most people at the individual level. Exercise really across multiple components, both cardio training and resistance training. It's very difficult to overstate the benefits that these bring. I won't bore you with the statistics. I've written chapters on it if you want. But what I think makes exercise so special is not only does it have the greatest impact on lifespan, which it does, right? Statistically, it has the greatest impact on lifespan. But as I say to my patients, even if exercising didn't help you live one day longer, its impact on health span and how you will function in the last decade of your life is truly unparalleled.
And a question for Peng, if you will.
Mr. Xiao, in what ways can AI and digital platforms empower people to build healthier habits and extend their health span in a more personalized, accessible way?
I think where Peter's work begins to show results the models that we discussed earlier that he's building begin to show it's effective, AI is the best platform to scale it and bring it at a low-cost way to the population. I want to say something very important here to echo our discussion earlier, Becky. We believe here, it is a suggestion I should shut up.
It is, it's so very interesting, but we're out of time as His Highness needs to leave.
I'll just say one last thing, if you don't mind, which is, Peter, you and I will discuss a lot more this topic later on. We need to catalog the language of biology. And at the G42, at M42, working with the Cleveland Clinic, we're looking at the 5 C's of biology language. The first is a code, sequencing data set. It's a source code of human beings. And Abu Dhabi here, almost 1 million people's data is in a centralized 120 petabyte database, fresh, consistent WGS information. This is our source code, the first C. The second C is core. Core is imaging data, is who you are today, how you are doing today, a snapshot of current affairs. Your CAT scans, your MRIs, that's the second C. The third C is chemistry, is your biomarkers, which need to continuously monitor and manage. And the next C is your cellular functions. And finally, the last C, I mentioned earlier, I'm wearing my Whoop, you're wearing your devices, context, track your lifestyle. But when you combine all these 5 C's, then you apply the final C on top of it, which is computation, you can actually build that giant AI model for biology. And that's really, I believe, our mission at G42.